But let's just talk about some of the defensive strategies that people use and how we can try and support them. Right? So there's different defensive strategies. Some people can cry for help. Some people can fight. Some people can flee. These are actually just in the language of polyvagal theory that we used before. Some people can try to connect, right? That's level one. I'm crying for help. I'm asking for help. I'm trying to connect. Some people are able to protect themselves. They can fight back. If they're connecting themselves or protecting themselves, either by fighting back or fleeing, those are better responses than if they're in a frozen behavior, right? A frozen behavior, which is hyperarousal or hypoarousal. So there's two freezes. There's tonic immobility and there's collapsed immobility. So one thing that is good to do with clients, right, just as a way of figuring out where they're at, is to sense into them what defenses can they do and what can't they do. And fight or flight are sympathetic. Actually, this version of freeze, which is tonic immobility freeze, is also sympathetic. And this is collapsed immobility, collapsed freeze. So what we want to do with each of our clients is to sort out what kind of defenses can they use? What are they able to use? Can they cry for help? Can they ask for help? Some people just can't, right? Some people can't ask for help at all. Some people can't fight back. Some people are in a bad situation, but they can't flee, right? You know? So what we're doing with this is just, working with whoever you're working with and finding out what kind of defenses do they have access to? What have they experienced? And how do they respond? And what's familiar? What do they use more often when they're threatened or stressed? What are their actions that they take? What situations might they have used these in? So when you're stressed, are you able to cry for help or not? I guess, maybe when I'm stressed at work, I'm able to ask, I'm able to ask for help. So maybe I'm able to do that. Or maybe it's a big blank spot, right? And that's very instructive. Like I never ask for help. Maybe I never fight back, So just kind of inviting people to think about times when they are able to or aren't able to, right? Or times when they're able to flee away or not able to, or times when they freeze, right? And this is the version of tonic immobility, where they're hyper alert, right? But they can't move. It's like they stiffen up, they feel paralyzed, but their heart is beating really fast. And so that's one version of it. Or this can just be collapsed and shut down, where they go numb, they're limp, they collapse, they play dead. So that's the classic understanding of the hierarchy.